Yes po, Doc.
Yes po, Doc.
Yeah. But your voice is very, very soft. I cannot hear your voice.
Soft as a cotton.
So we'll take up psychiatric history. So it's very loud. My voice is very loud, or it's just moderately loud?
Directly loud.
It's okay, Doc. It's okay.
It's okay. Okay, we'll take up the psychiatric history. Now, in any case, whether medical, surgical, or psychiatric, it's very important when we take the case of a patient, we usually get the history first, no? Because of all your diagnosis will usually depend. I think it's 90% that history is very important in diagnosis or in diagnosing the patient. But however, psychiatric history is very different from your other medical history, since psychiatric history has some limitations, because sometimes your patient is the one only being asked, or there are no other informants, no, only the patients. And your psychiatric history covers the whole life of the patient, the life history or life story of the patient. Unlike in the medical field or in surgical, when you are taking the history of the medical, for example, the patient has a cough, you will only take the history of cough, of when was it started, no? So in psychiatric history, we have the outline. No? So you have your identifying data. Identifying data is the same in your other medical or surgical history, or in any other case of a patient. You have your name, your age, the civil status of the patient, where the patient came from, and where the patient is living, who is with the patient, or when you are asking the patients living with him for a long time, it's also very important, or just the patient is currently living. Why it's very important whether the patient has been living for a long time. For example, there are only two in a house. Sometimes there is what you call folie à deux. No? What is folie à deux? That is sharing of the patient's psychosis. That is folie à deux. So it's very important that in identifying data, you have to write there where the patient has been living for a long time, whether with his sister or his brother or his mother, or her husband or her live-in partner. So it's very important that it should be written there. Anyway, identifying data is the same as in other history as the case may be. But in identifying data of a psychiatric patient, it is very, very important where the patient has been living for a long time. Because sometimes patient has been transferring to one caregiver or caretaker to another, especially the stigma in the community. No, they are ashamed that the patient has been their relative or their sisters or their brother. So you have to write the current living residence, or the previous residence, or the time that the patient has been living up to the present. So that is identifying data. Now, age, address, age, civil status, no? Then with gender, even the even the religious affiliation, it's very important. And whether she has a live-in partner, it's very important also. No? Then you have chief complaint and problem. In the chief complaint and problem, it's very important there that chief complaint is very verbatim. No, for example, the patient will come to you. The patient will say, "Kay gindara ako ni ranganhi." So you have to write down, "Gindara ako nganhi." Okay, because you will ask, "Ano timo kano nga gindara ka nganhi?" Do not ask the patient like when you say, "Ano tim problema?" The patient, most of the patient are intelligent and they cannot accept. No, they have denials. So do not instill words that would incite or irate patients. So it's very important that you have to ask the patient, "Ma'am, kay ano anhi kita?" Like that. Do not ask like, "Ano ting problema?" Because some patients are, as I've said, incited and or irritated. So they will throw the problems to you and they will say, "Ikaw, ano ting problema?" No? So do not ask, put words into their mouth. You have to ask, "Why are you here? Kay ano gindara ka nganhi? Kay ano aanhi kita?" So if the patient will answer, "Ambot kay ano gindara ka nganhi." So have chief complaint, you have to write there, "Ambot kay ano gindara ako nganhi." And then you have to ask, if there is a relative, you have to ask the relative, why is the patient was brought to you? So if the relative will say the patient has been brought because of sleep problem, so you have to write it down. So meaning to say, there are two chief complaints: the chief complaints of the patient verbatim and the chief complaint of what the relative has been telling you or has said. So it is very important in this because you will know that for the next time when the patient comes to you, the patient can already answer you, not in a way that she or he answered you the way the first time he came to you. If the patient is improved already, the second time he will not answer you like that. So as if this is a sort of parang progress note of your patient, no? Because she has already an insight, no? That she is sick. So she has already a different chief complaint when he tells you or when he told you. No? So what are the importance of your psychiatric history? What are the things that it's very important? Present illness, no? So if the patient has been brought to you, the patient is having, for example, the patient now, when the patient is in front of you is talking to self, no? So onset, you will not put onset as talking to self. You have to go back when the patient was still normal or before the onset of talking to self. No? For example, the patient was working in the hospital, or the patient was working as a clerk. And then the boss called her and she told that she was being harassed, sexually harassed. Then chronologically you have to write it down until the patient was already talking to self or irrelevant, no? So that is the onset. Again, the onset is not what you see the patient now, no, talking to self, no. For example, if the patient is talking to self or dancing, no, that's not the onset, no. You have to go back when the patient was still, the behavior of the patient before the patient was talking to self or dancing or any other behavior when you meet the patient in front of you. So precipitating factors. What are the precipitating factors? No, you have predisposing, you have precipitating factors. So in there, you already know that it would be incorporated in your present illness, the precipitating factors, no? The harassment of the boss, no? Then he was not being given the salary anymore. What else? The boss kept on calling her. So those are the precipitating factors, no? Anyway, we will be taking up the predisposing factors. Predisposing is you cannot change. Like for example, the race of the patient, the age of the patient, no, the gender, that is predisposing factor. Those are example. Precipitating is you can still change, no? Predisposing is you cannot change anymore. No? So that is the present illness. Then let's go to past illnesses. No? So what is very important in your past illnesses? No? You have there identified as psychiatric illnesses, no? So if the patient, you have to ask the relative or the patient that have you been brought to a psychiatrist, or sometimes do not tell them a psychiatrist, a doctor, and for that matter before, because they deny, they cannot accept that they have been a psychiatric patient. So you may ask the patient, have you been brought to a doctor before? And the patient will answer you, yes, I have been brought to the doctor before. So you can ask already, what are the medicines? What are the medicines that has been given to you? No? What is the dose? For example, if the patient will tell you that I was brought to EVRMC, no, I was brought to the psychiatry department, no, and the medicines are the following. So you have to write down the medicines. Then you have to ask, how long have you been admitted or as outpatient? No. So in this way, you will know if the patient has been admitted that there is a possibility that it is a poor prognosis because the patient has been admitted, for example, in National Center for Mental Health in Mandaluyong. They have been there for 3 months. No, so an outpatient. If the patient is outpatient, so you have already an idea of the prognosis of the patient. Then you have to ask the medicines. So what are the medicines that the patient has been taken? So they will tell, no, the medicines, these are the medicines that the patient has been taking. For example, risperidone. What is the dosage? So 2 milligrams, 1 tablet, once a day or 2 times a day. So what else? What are the other medicines? When was the last time that the patient took the medication? Because when the patient goes home and they do not have money to buy, they will try to self-medicate and they will reduce the medication. And you will wonder why now when he comes to you, when he comes to the doctor, that the patient is on a relapse. And yet, the relative would say that, Doktora, natikman lagyap ito ni ran medicine. She's still taking the medicine. Oh, but only to find out that they reduce the dosage. So sometimes it is confusing. It will confuse you why the patient was brought to you. Well, in fact, they said that the patient has been taking the medication, but only to find out that they reduced the dosage of the medication. So it is very, very important. Or sometimes they will just tell you that, Doctora, we only give the patient when the patient cannot go to sleep because it is the problem was the patient cannot go to sleep. No, If you have, for example, risperidone, that is already an antipsychotic. For the sleep impairment, that it's different. It is hypnotic. No? So do not ever believe that what the patient will tell you, that they will say that it is doctora, we only give during or when the patient cannot go to sleep. No, so try to ask, to dig deeper, so that you will know why the patient has been brought to you, but the patient is very psychotic or grossly psychotic, but they tell you that they have been taking the medication, only to find out that they reduce, no? Or only when they cannot go to sleep. But you know that that medicine is an antipsychotic. No? Then you have the medical. No? The medical history is when the patient has been a patient for a long time. No? The patient has been there. For example, the patient has a problem, thyroid problem, and the patient has been brought to you now. So you will know why the patient has, for example, depression, no? Or there is a comorbidity already. The patient has stroke. So that's why in front of you, the patient is already having dementia. So that is very important, the medical. No? Then you have alcohol and other substance history. No? The alcohol, so you will ask, no? In medical, you will also ask how long the patient was, when the patient had a stroke, how long the patient, what was the medication of the patient, no? So you have to ask that, the medical, the comorbidity. Then the alcohol. So how long the patient has been taking alcohol, no? From the very start, from the high school, and other substances, like for example, uh, the marijuana, or any other, the ecstasy, or the energized, mga pan-energized na mga substances. So you have to ask that. No, it's very important. Why? Because alcohol is a depressant substance. No? Can you see? Alcohol is a depressant substance. No? So you will know why the patient is having depression now, because you have to correlate that the patient has been taking alcohol for a long time. No? So alcohol's psychotic depression secondary to alcohol intake, no, for a long time, no. Another history, no, substance history. Then you have your personal history, or that what you call an anamnesis. An anamnesis, you have there your prenatal and perinatal. So what is prenatal? When the child is still in the womb of the mother. So you have to ask whether the patient has been inside the womb of the mother has been taking medications or any other medicines for that matter when she or he was still pregnant, or when the mother has a psychological problem when he was still pregnant, or there is a prenatal checkup. No? So it's very important, no? Because even if you are still in the womb of your mother and your mother has a psychological problem or any substances that she has been taking, it will affect the patient. No? So that is global. The effect is global when you are still inside the womb of your mother. Then you have perinatal. Perinatal is when you are already being delivered, whether there is some sort of injury during the delivery, no, it's very important. Or whether the patient has a cesarean section when he was delivered, or when she was delivered at home or in the hospital. No? So it's very, very important to ask so that you will know why the patient maybe has this psychological or behavioral problem. No? Because even in the womb, inside the womb, and during the delivery, there is already a problem. Then you have early childhood through age 3. No? So in perinatal, that is 0 to 1 year old. No? 0 to 1 year old, that is perinatal. Diba? So that is trust versus mistrust. No? So you will already have an idea. No? Then in early childhood, you have through age 3. No? So it covers there perinatal, 0 to 1 year old, that is oral stage, then early childhood through age 3, 0 to 1, 1 to 3 years old, that is early childhood. So what are the things that covers in early childhood through age 3? Diba? It's here, 0 to 1, 1 to 3, that is autonomy versus shame and doubt. No, it's there. No, so what happened in the autonomy stage? That is, autonomy is independence. So this is the time when the child starts to be to call that, to be disciplined for toilet training. Why? Because at this stage the child can already control his muscular sphincteric tone. So that's why you can stop the patient from saying that the patient will say that he was being treated rigidly, so that when you become adult, you become obsessive compulsive. No, if you are, there is always pathologic side, no, of how you were brought up. No, there is pathologic effect. No, if too lax, there is pathologic effect. If too rigid, there is pathologic effect. So that is 1 to 3. That is autonomy versus shame and doubt. So of course, in autonomy, independence, the child has many false moves. No? Okay? The child has many false moves, and of course, in your trying to become independent, not all that you can control. For example, at times you can move your bowel in your sala. So what happened? Sometimes you are being spanked by your parents. Sometimes you are being what you call that, in front of your visitors. You are being scolded. So what happened? You have shame and doubt. No? So as if what you are doing, since you are trying to become independent, since you are trying not to move your bowel at the sala, no? But however, because you cannot yet have a full control of your sphincteric tone, there is the possibility that you will have also shame and doubt. No? That is early childhood. Then let's go to your middle childhood. No? So your middle childhood covers your initiative that is 3 to 5, no? 3 to 5 and 6 to 11, no? So what is in the middle childhood? The third stage, no? Uh, the child here, the third stage, 3 to 5 years old, the child here tends to become curious. No? Here, so you can observe that even you, when you're still child, you try to be opening of the toys that has been given to you, but you're with your parents and it's very, very expensive, and you try to destroy because you are curious at this stage, because it is a part of your development. No, so 3 to 5 years old, that is an initiative. You try to be curious, you try to open up things, uh, And after that, 3 to 5, you have 6 to 11. That is already your industry, versus inferiority, 6 to 11 years old. So this is the time already that you are fully going to school, even 3 years old. Inside the womb, you're even already enrolled now, So, but during the full development of your intelligence, you are there at 3 to 6 to 11 years old. That's why you can focus your lessons at school. You can acquire skills, knowledge, because in here uh, your development is geared toward skills development at 6 to 11 years old. So that's why when your parents, so it's very important here, this story is very important. So sometimes when the parents who are already abroad, so when they come back, when they comes back, they try to blame their children, that their children is not anymore interested in going to school, and they will blame that they have been going abroad, they have been working there far from the family. But you cannot just tell that way, because at 6 to 11 years old, as I've said, this is the time when you have the full development of your skills and other intellectual development. And if it is being focused, you are being guided by your parents. In high school, you will also have a uh, good intellectual development, and you cannot be blamed when the parents are there to guide you. But if they are not around, you tend to have 6 to 11 in that is industry versus inferiority, because you do not have interest anymore, because no one guided you, your parents was not around, they are working. But that is money versus of course food versus how you were brought up. Sometimes it's very difficult to weigh, but that is a part of your history. Nevertheless, you will know why the patient go into that stage, that she was not able to finish even in elementary because they were not guided, Then you have 11, late childhood, 11 years old to 16, to puberty or through adolescence. So this is the time wherein you have to get the history, whether the patient has been uh, with the parents, or with sisters and brothers, or when the patient has been running away from home, or the patient has been taking drugs. Why? Because this is the stage when you have the stage where you are what you call identity. You are looking for your identity. Who am I? Where am I going through? So it's very difficult for you uh, to understand, especially when the patient is running away from home, going into drugs. Because when you go to your clerkship and there is somebody who takes or who took drugs, it's just not a matter of saying that the patient becomes psychotic because he took drugs. No, it is a part of psychodynamic of your development. So it is very important that during your late childhood, you have to ask why did the patient go into drugs? So you have to get the dynamics of the family, whether the family was an intact family, whether the parents, the mother and father are always fighting, whether they are being just left by the parents. No? So it's very, very important. And sometimes there is conflict, especially nowadays, that the baby boomers and the Z gene or the millennial or the millennium, no? So there is a problem between parents and children. Why? Because here the parents already cannot understand anymore the children. So before, for example, uh, you have you will go to disco houses, or you will have your um, going to the attending the, especially during fiesta here in Tacloban, you will be attending the band, and the parents could not understand that you will be staying there up to 1 o'clock or 2 o'clock in the morning or 3 o'clock, because before 10 o'clock is already done, no, you are already at home. But here it's there is some conflict of the parents. So that's why the children will have a running away from home, or will go to his barkada who have the same problem wherein the parents could not understand, and they will be taking the drugs. So they will understand each other. So it's just not a matter of taking drugs, but there is a psychodynamic within the family. No? Or when the parents is very strict and the children could not understand. So before, sometimes we will buy, it is better now that there are already pants that are having holes, no? Because before, your parents will buy pants and you have to make some holes on your pants and they couldn't understand. So you will say that my friends are doing like this, so there will be conflict, no? Or sometimes you will be taking drugs because you are not being, uh, your parents will not allow you to go into other religious affiliation. So it's very important. Here, late childhood, that is what you call that. The psychodynamic is very important here, no? Because you are looking for your identity. You have hero worship. Hero worship, sometimes you will uh, follow the your teacher, you follow your friends, the way they dress, or you will follow the mga artista, no? And if you cannot do that, it's very important that uh, how you will, to call that, how you will try to cope with this, because the reality and the home is different. So you are confused, no, at this stage. So that's why, as I've said, there is taking of drugs, that is running away. That is only the consequence of your how development is, or how you were brought up at home. No? So it's very, very important. No? So let's go to adulthood. No? So in adulthood, it's very important to take up occupational history. No? So you are already taking the history of the patient. No? Occupational history. So what is significant in your occupational history? No? So many of us already, for example, some of us are working, some of our friends are working in the bank, no? But they are nurses, no? So some of them are overloaded and others are have no work, no? So sometimes there is no appropriate uh, courses wherein you are working. So it's very difficult for you to understand, or you cannot cope up with the same worker who have, for example, commerce, and you are working in the bank. It's different. You are a nurse and you are working in the bank, so it will affect you. So sometimes it becomes a problem, no? So you cannot cope up. You have to be asking your friends, so our commerce graduate. That is occupational history. And sometimes it is also important because there is in the family favoritism. So you want to become doctors, and your younger sisters or older sister would just get another course because the tuition fee is very great or very big. So what happened? This is the start. They do not want to work, and the family would say that you are very lazy, but only to find out that this is the start of his illness. She doesn't want to work. Why? Because the dream uh, of study is to become a doctor. But because you are there studying doctors, she wasn't able because the family could not afford two doctors at the same time. That is occupational history. The load you have in the workplace, your profession is not related to your work, and sometimes there is sexual harassment there. It's very, very important. No? Then another is you have your marital and relationship history. So some of you are already married. So sometimes or others are living with your in-laws. No? So you cannot breathe when you are living with your in-laws because many times when you are there, especially women, you are being destroyed by your in-laws. Good if you have a very good in-law, very supportive, but especially when your husband, the son, is working away from you or abroad. So sometimes the parents, of course, there's already a competition. Why here a competition? Because before the parents can give money to the husband, your husband can give money to the parents, and now you are there, they will not be giving money to the parents but to you already. So that is a part, it becomes a conflict. So sometimes what happened when your husband is not around, they will make stories against you. No? That is marital and relationship history. And another, before that, especially nowadays, sometimes you do not know yet your husband. No? 1 week, eyeball, and then married. No? Then you have a wedding. And that is isang linggong pag-ibig. After that, you have to have separation, and then you have annulment. No, so that is very important, no, in your marital, and that is the start of why the patient got that problem of sleep problem at the first. Sometimes they will just say, Tora, diri malak na nga turog, it's only sleep impairment, but that is the window to a psychiatric problem. No? Then you have military history, of course. You will not be delving patient who have not gone to military. No? But you have to ask whether she or he has experience in military work. If the patient has no experience in military work, of course, do not be asking history because she will not know. It would take time and the patient will get irritated, no? Especially when they're already they have signs of psychosis. No? Another is your educational history. I've been mentioning this already. No? Educational history, appropriate education where you are working. No? The education, the courses that you want. No? Because of you are many in the family, you cannot take what you want. No? Or sometimes you have have many failures because there are many factors. No? Sometimes because you do not want your course, your parents would compare you with your other siblings that your other sibling has a good, you call that as a good performance in school, but only to find out because you do not want the course that you have, you will not pursue. No, you do not want to work. No, so sometimes you will leave in the family because out of jealousy. No, that is educational history. One time I have a patient, no, so my patient, she was living. They were living in one family. However, she was closer to his grandma. Her grandma died. So when her grandma died, the patient did not anymore go to school, no? So the family could not understand, no? He was my coworker, a nurse in the hospital, and the nurse told me that her son does not go to school anymore, a high school student, after her grandma died. So I said, let your son come. And the nurse said, "Na, I think Doctora, she will not see you because she doesn't want to be, he will not accept. Just let him come, no, and ask money from you." So when that son came to the hospital to ask money from her mother, a nurse, so I was there because we already agreed the time, no, the son will arrive. Until this time, when the son was there already, um, the mother, oh, this is your son. So what happened? How are you? So I had we had a story, you know. We talked with the son, I talked with him, only to find out that he did not anymore go to school, no, because he was still suffering from. He was still on the bereavement period because he was very close to his lola, no, to his grandma. So, but the family could not understand. Even the mother, who was a nurse, could not understand why his son does not anymore go to school. And everybody was telling him, oh, you were the favorite of grandma and you do not go to school anymore. We hate you. No? So everybody hated him. But they did not understand that that adolescent was not anymore interested because he was going into depression, no? When his grandma died. So when I talked to the nurse, I told her, Mom, maybe you have to talk to your son and give him attention, all your attention, the whole family members, that you can go to school. Because, of course, sometimes men could not, is not as expressive as women. So he did not express that he was already having depression with his grandma because he was living with his grandma in the room. They were together, so he was the favorite. But the family could not understand when he stopped schooling. So after that, the family understand, and the adolescent went back to school and already is a professional. So that's educational history. That's very important, no? Then you have religion. Religion is also very important. Why? Because sometimes in one family, you have 5 religious affiliation. You have Christian, you have Iglesia ni Cristo, you have what are other name those religious affiliation, no? Name them, Roman Catholic. So at the same time, inside the house, there is chaos. Why? Because the Christian will say, we do not believe in what you call it, saints. So they will throw the images of the saint, and they are, of course, the mother who is a Roman Catholic would get mad. So there will be chaos that happen in the family out of religion. So those members who are very, for example, dedicated to their religion, no, they have been reading the Bible for a long time. They're even becoming a pastor one day. So this just start, no? Or sometimes it is a cult. So you are not allowed to eat for 1 month, only milk. So you are being brought up inside the places wherein you cannot see your parents. So there are many factors in the religion wherein it could cause psychological problem or even depression because you have different religious affiliation in one family. No? So that is included in your history. No? Then social activity. What is important in social activity? So parents sometimes also could not understand, no, especially nowadays. No, there is a very big gap between the baby boomers and the seasoned generation or the millennials. Social activity, you are not allowed to go out the wee hours of the night. Well, in fact, at 2 o'clock, the activity would just start, no, at this time. No? But yet the parents would not understand and they will stop you from going there. So what happened? There is conflict between the parents and the children, wherein there is misunderstanding or the parents could not understand why they go into this going out of the night at this time of the night at the wee hours of the night. So it started that. So they became depressed. They do not want to go out anymore. No, or sometimes in the family there are still families wherein parents would not allow children to entertain visitors. So what happened when they become workers? When they get to work already? So they tend to become aloof with the workers. So when there are problems, when they try to interrelate with their co-workers, they have difficulty because that is how they were brought up. That is social activity. So sometimes it's just start there. So that's very important also, taking up the social activity of the patient. Oh. Then you have your current living situation. Current living situation means, of course, your current. Whether you are living with your Lola, whether grandma, or you're living with your uh, parents, whether the one who is sustaining your study or giving money is your auntie who is abroad, no? So you do not believe in them, in your parents, because sometimes the patient would tell you that you are not the one sending me to school. No? So there is chaos in the family again. So it starts from them. So your child will start living in another house because the sisters or the auntie are the one giving money. No? Or in the family, there is, especially, I have a patient, there is one room house, no? So there is no privacy there. So you will just change your wardrobe, your clothes with the family, with the male, female. You do not have any privacy. Sometimes current living situation will also is reflected also wherein the mother is the one giving money, so you will only believe your mother rather than your father because your father does not give money. That is current living situation. So there are different factors in current living situation. Sometimes you have been living for a long time of enough or more than enough. You can afford everything, and also it's time that your parents were not working anymore, no? Especially this pandemic. So you will know that there are many even big companies that closed, no? So it affect very much their family, no? Even economically, no? That is one a big factor, no? That is current living situation that you should uh, be aware of in asking your patient, because your patient will not voluntarily tell you. They will not say, because we are like this, we are like that. You have to ask them. That's why you have your outline, because it's very important. But maybe you will not take this sequentially, because you can ask on one aspect and then you can get the other, no, from the living situation. For example, marital history. So Where are you living? So I'm living with my in-law. So you will know already what is to be living in the with in-laws, no? Current living situation. You will have an idea already, okay? So that is current living situation. Then you have legal history. Of course, in legal history, like the military history, you do not have to ask if the patient has no experience in having legal cases. For example, he has been brought to the barangay captain for this reason, for alleged reason that she has been stealing, or any other that he has been gambling. No, so that's legal history. But if the patient does not have that problem, and maybe you just ask a side question, like, for example, have you have any had quarrel with your neighbors and you were brought to your barangay captain, like that. No, it's the practical ones, the reality, the realistic one. You should have to ask them. No. Then you have sexual history. Of course, sexual history is like military and legal history. Uh, it's very important also, but you will not be asking if the patient has not been raped. Do not be asking patient, oh, how did you know you're sexual? Did you have your first sexual, what you call that, sex with your boyfriend? How many times do you have sex with your boyfriends? Do not ask like that. No, you have to ask only when the patient has a problem regarding sex. No, for example, she has been raped. So that is sexual history. Then family history. In family history, this is very, very important because why? In the family, there are families or members wherein they are very close to each other. So sometimes when his closest member left, he becomes depressed because this member, this other sibling, is the one wherein he can relate his problem. No? So you have to write it down also there. Because I have a patient also that his other sibling left, he got depressed. When I got this story, I found out that the the his elder sister left for work. So he got depressed. So if you will not ask that, you will not, it's very important. Medicine is there, but let the patient express. No, you are doing now psychotherapy. It's not only medicine that's very important. No, it's very important that you will take the psychodynamic, no, of the patient's behavioral or psychological problem. No? Family history is also, especially nowadays, uh, you have so many incest relationship. No? Sometimes children are being raped by their father. No? So I have a patient raped by their brothers. No? And I have a patient who got pregnant of his father. No? So she was the youngest child. They were three. They do not talk each other how it goes, no, or how it went, no, only to find out when the youngest child was brought to me by the concerned citizen in their area. The the that patient has been raped by the father for a long time. That time, the patient was already 5 months pregnant from his father. The other two does not go home during lunchtime because the mother does not go home during lunchtime because he was a laundry woman. No, so only the youngest, who was a second year high school, who was studying nearby, would go home. And the father would take advantage. No? And the last time, that one, when the child revealed that he has been raped by his father many times already, but the elder sisters has also been having, the father has a sexual advancement already, but of course they're already big. They know what to do. And the high school student does know. at that time, when the high school student told his aunt, told her aunt, when he was about to get inside the house, the father pulled him again and had another sex with her. So after that, he was thinking of something that he can go out immediately to tell, because he cannot anymore, what you call that, take what his father was doing. His father keep on drinking. So there are many, I think, in the family, even middle or even above middle income family, but they want to keep this one because this is a taboo in the community. But this one who are usually being revealed are the poorer ones, no? For example, also the family, the father is the one who took advantage, no, of the patient, and the father is relative of the political, no? For example, the mayor, so he cannot be put to jail because the father would rely the political authority of his relative. So sometimes the victim or the patient is very much call that he cannot do anything, no? So you would go to the social worker. So it's a process. It's very, very tedious process, and sometimes they would not believe. Even the mother would not believe, no? I have a patient. The patient was brought to the hospital because of bleeding. The mother had a live-in partner when the child was already 2 month old inside the womb of the mother. So as if the father is, as if she is already his child, but the mother did not know that when he would left, no, he was leaving, no, to buy something. She leaves to buy something. The partner would, 7 years old child, the partner would take advantage by raping the child. So by the time that the child was being brought to the hospital and was told to lie down, the patient would have with tremors, no? He had some sort of fear because maybe he could reminisce what the father was doing to her. So that time when the child was being brought to the hospital, you know, the mother was with the father, her partner, at the prison cell, and she did not take care of the child. The neighbors was the one rather who took the child. See, the family history is very, very pathologic, no? So in the family, sometimes there is factions, no? For those who give money, for those who do not give money, no? So you would rely on there, you would side on there, no? That is very important. That is what you call pathologic family. No, it happens. No, I don't know. No, we just discuss it here, no, because it's very important. Then you have fantasies and dreams. Fantasies, of course, are your dreams, no? And dreams are your trying to do in the future, no? So sometimes you are frustrated, no? Sometimes you want to become like this, no? Sometimes you want to live and yet you cannot do because of some economic problem, no? So these are the things that we should take in when we have your psychiatric history. It is a life history of the patient. So you will understand why the patient went into or go into depression or go into psychosis. That's because of your life story of the patient, which is the psychiatric history. So from this, I will end my lecture. We will take up again because your bi-monthly is November 16. So we will continue your lecture. And on November 16, I will be giving you the first quiz and the bi-monthly and at school. Okay? So I will end up my lecture here. Okay, thank you very much.
Thank
Thank
you,
you.
Doc.
Thank you,
Thank you,
Doc.
Doc.